Hello, my name is Katelyn Lumpkin. I'm a family nurse practitioner student at Arkansas State University in Jonesboro, Arkansas. The name of my study is Wait and See Approach for the Initial Treatment of Acute Respiratory Infections. Introduction. Antibiotic resistance is a problem all over the U.S. and also across the globe. According to the CDC, there are 47 million unnecessary antibiotic prescriptions written each year, and most of the unnecessary prescriptions are for acute respiratory infections that are most commonly caused by viruses or bacterial infections that do not always require an antibiotic. Most upper respiratory infections have an incubation period of 3 to 10 days. The CDC includes fever, cough, rhinorrhea, nasal congestion, postnasal drip, sore throat, headache, and myalgias as symptoms. Some patients may experience symptoms for up to 2 weeks, such as smokers. Acute respiratory infections are usually viral and self-limiting. More than 90% of acute bronchitis has no bacterial cause. A wait-and-see approach for the initial treatment of acute respiratory infections is one method that can help reduce the amount of antibiotics prescribed. With a wait-and-see approach, patients either do not receive any medications or they receive medications that help to treat their symptoms, such as a cough suppressant. The patients then follow up with their provider and only receive an antibiotic if their symptoms worsen or if an antibiotic is then indicated. In 2017, 70% of antibiotics were unnecessarily prescribed for acute upper respiratory infections for patients aged 20 to 64. The purpose of this research study is to raise awareness of antibiotic resistance. Methods. An IRB was obtained through Arkansas State University. A retrospective chart review was used to compare the percentage of antibiotics prescribed for initial treatment of acute upper respiratory infections in adult patients with no comorbidities at a local family practice clinic in Northeast Arkansas to the national average of 70%. Charts were selected by using the ICD-10 code J06.9 or acute upper respiratory infection. Examination dates were from January 2019 to November 2019. 15 charts were reviewed. Information obtained from charts include age, gender, race, smoking status, if an antibiotic was used as the first-line treatment, and if so, which antibiotic was used, and if a wait-and-see approach was implemented before prescribing the antibiotic. Population. Charts of patients between the age of 18 and 40 were included. Exclusion criteria, charts of patients with comorbidities such as COPD, congestive heart failure, charts of pregnant patients, and charts of patients younger than 18 or older than 40. Findings. The percentage of patients that a wait-and-see approach was utilized as the initial treatment was 73%. 40% of patients were given an antibiotic as treatment. One patient was also diagnosed with a UTI, and another patient was also diagnosed with pharyngitis. So the antibiotic that was chosen was used to treat both those conditions and the upper respiratory infection. 2 patients were given Zithromax, 2 patients were given doxycycline, 1 patient was given amoxicillin, and 1 patient was given Levaquin. There were 4 patients that received an antibiotic first before a wait-and-see approach was initiated. 27% of the patients were smokers. This chart compares the choice of treatment. 73% used a wait-and-see approach as the first-line treatment, and 27% were prescribed an antibiotic as the first-line treatment. This chart shows the percentage of unnecessary antibiotics prescribed. The family practice clinic in Northeast Arkansas had 26% compared to the national average of 70%. Discussion and action plan. The local family health clinic in Northeast Arkansas is below the national average of prescribing unnecessary antibiotics. Even though it was below the national average, education should be provided regarding the antibiotics that were prescribed too soon. The wait and see approach was utilized for 73% of the patients, so it is unknown what was different about the patients that were given an antibiotic. Antibiotic resistance continues to occur and is up to providers to do their part by not prescribing unnecessary antibiotics. Further research needs to be performed due to limitations. There were several limitations of this study. To start off, there was only 32 charts that utilized the ICD-10 code of J06.9. Only 15 of those were able to be used because of the exclusion criteria. The clinic is a small rural clinic, so there's limited geographical sampling, and then patients over the age of 40 were not included due to a higher risk of having comorbidities such as COPD. I would like to acknowledge my clinical instructor and advisor, Lauren Hancock. References are available upon request. Thank you.